HESI Fundamentals Questions with Answers. Question 1. What type of therapy delivers high concentrations of oxygen to the lungs? Oxygen therapy, ventilator therapy, mechanical ventilation, CPAP therapy. A. Oxygen therapy. Correct answer. The correct answer is A. Oxygen therapy. This type of therapy delivers high concentrations of oxygen to the lungs to improve oxygen levels in the blood. Ventilator therapy, B, involves mechanical breathing assistance, not just oxygen delivery. Mechanical ventilation, C, is a broader term encompassing various types of mechanical respiratory support beyond just oxygen. CPAP therapy, D, is continuous positive airway pressure used to treat sleep apnea, not specifically for delivering high concentrations of oxygen. Therefore, oxygen therapy is the most direct and specific choice for delivering high concentrations of oxygen to the lungs. Question 2. What is a device that delivers a fine spray of medication into the airways? Nebulizer, inhaler, oxygen concentrator, peak flow meter. A. Nebulizer. Correct answer. The correct answer is A. Nebulizer. A nebulizer is a device that delivers medication in the form of a fine spray into the airways, making it easier for the patient to inhale the medication and reach the lungs. It is commonly used for treating respiratory conditions such as asthma and COPD. Inhalers, B, deliver medication in a different format, through a measured dose of medication in aerosol form. Oxygen concentrators, C, provide supplemental oxygen and do not deliver medication. Peak flow meters, D, are used to measure the peak expiratory flow rate and are not used to deliver medication. Question 3. Which test measures how much and how quickly you can move air out of your lungs? Spirometry, peak flow meter, lung volume test, arterial blood gas. A. Spirometry. Correct answer. Spirometry is the correct answer because it measures the volume of air exhaled in a specific time frame, assessing lung function and capacity. It is commonly used to diagnose conditions like asthma and COPD. Peak flow meter measures only the maximum speed of exhalation, not volume. Lung volume test measures the total lung capacity, not the speed of air movement. Arterial blood gas measures oxygen and carbon dioxide levels in the blood, not lung function. Question 4. What procedure is used to visualize the airways and diagnose lung disease? Bronchoscopy, thoracentesis, pulmonary function test, chest X-ray. A. Bronchoscopy. Correct answer. The correct answer is A. Bronchoscopy. Bronchoscopy is a procedure where a thin, flexible tube with a camera is inserted into the airways to visualize and diagnose lung diseases directly. It allows for direct visualization of the airways, collection of samples for biopsy, and removal of obstructions. Thoracentesis, B, is a procedure to remove fluid from the pleural space, not for visualizing airways. Pulmonary function test, C, measures lung function but doesn't directly visualize airways. Chest X-ray, D, provides an image of the lungs but doesn't allow for direct visualization or diagnosis of airway diseases. Question 5. What is a condition characterized by episodes of severe, acute shortness of breath, often occurring at night? Paroxysmal nocturnal dyspnea, sleep apnea, orthopnea, dyspnea. A. Paroxysmal nocturnal dyspnea. Correct answer. The correct answer is A. Paroxysmal nocturnal dyspnea. This condition is characterized by sudden, severe shortness of breath at night. It can be caused by heart failure or other cardiac conditions. Sleep apnea, B, is a disorder where breathing repeatedly stops and starts during sleep, not specifically related to acute shortness of breath. Orthopnea, C, is difficulty breathing while lying flat and is not specific to nighttime episodes. Dyspnea, D, is a general term for difficulty breathing and does not specifically refer to acute episodes at night. Question 6. What is a condition where the airways become inflamed and narrow, making breathing difficult? Asthma, bronchitis, pleurisy, tuberculosis. A. Asthma, correct answer. Asthma is the correct answer because it is a condition characterized by inflammation and narrowing of the airways, leading to difficulty in breathing. This is due to various triggers causing the airways to become inflamed, swollen, and produce excess mucus, resulting in constriction and breathing difficulties. Bronchitis, pleurisy, and tuberculosis do not directly involve narrowing of the airways as their primary mechanism, making them incorrect choices. Bronchitis is inflammation of the bronchial tubes, pleurisy is inflammation of the lining around the lungs, and tuberculosis is a bacterial infection primarily affecting the lungs. Question 7. What is a chronic lung disease that includes chronic bronchitis and emphysema? Chronic obstructive pulmonary disease, COPD. Pneumonia. Asthma. Tuberculosis. A. Chronic obstructive pulmonary disease, COPD, correct answer. The correct answer is A. Chronic obstructive pulmonary disease, COPD. COPD is a chronic lung disease characterized by chronic bronchitis and emphysema. Chronic bronchitis involves inflammation of the bronchial tubes, leading to excessive mucus production. Emphysema is the destruction of lung tissue, resulting in difficulty breathing. Pneumonia, B, is an acute infection of the lungs. Asthma, C, is a chronic condition characterized by airway inflammation and constriction. Tuberculosis, D, is an infectious disease caused by Mycobacterium tuberculosis affecting the lungs. Therefore, the correct answer is A as it specifically encompasses chronic bronchitis and emphysema, distinguishing it from the other options. Question 8. This is the inflammation of the heart's inner lining, usually caused by an infection. Endocarditis, myocarditis, pericarditis, valvulitis. A. Endocarditis, correct answer. The correct answer is A. Endocarditis. Endocarditis is the inflammation of the heart's inner lining, often due to an infection. Endo- refers to the inner lining of the heart, endocardium, and itis denotes inflammation. Myocarditis, B, is inflammation of the heart muscle, pericarditis, C, is inflammation of the outer lining of the heart, and valvulitis, D, is inflammation of the heart valves. Endocarditis specifically targets the inner lining, making it the correct choice. Question 9. What is the narrowing of the arteries due to the buildup of plaque, which can lead to heart attacks and strokes? Coronary artery disease, peripheral artery disease, aortic stenosis, mitral valve prolapse. A. Coronary artery disease, correct answer. The correct answer is A. Coronary artery disease. This condition involves the narrowing of arteries supplying blood to the heart due to plaque buildup. Plaque can lead to blockages, causing heart attacks and strokes. Peripheral artery disease, B, affects arteries outside the heart. Aortic stenosis, C, is the narrowing of the aortic valve, not arteries. Mitral valve prolapse, D, is a condition affecting the mitral valve, not arteries. Therefore, A is the correct answer. Question 10. Which condition involves the heart muscle becoming abnormally thickened, reducing its ability to pump blood? Hypertrophic cardiomyopathy, dilated cardiomyopathy, Restrictive cardiomyopathy. Ischemic cardiomyopathy. A. Hypertrophic cardiomyopathy. Correct answer, step-by-step rationale. 1. Hypertrophic cardiomyopathy, A, is the correct answer. 2. In this condition, the heart muscle thickens, leading to decreased blood pumping ability. 3. This thickening can obstruct blood flow and increase the risk of abnormal heart rhythms. 4. Dilated cardiomyopathy, B, involves the heart enlarging and weakening, not thickening. 5. Restrictive cardiomyopathy, C, involves stiffening of the heart muscle, not thickening. 6. Ischemic cardiomyopathy, D, results from reduced blood flow to the heart, not thickening. Question 11. What type of stroke is caused by a blockage in an artery supplying blood to the brain? Ischemic stroke, hemorrhagic stroke, transient ischemic attack, embolism. A. Ischemic stroke, correct answer, the correct answer is A, ischemic stroke. This type of stroke is caused by a blockage in an artery supplying blood to the brain, leading to a lack of oxygen and nutrients to brain cells. This blockage can be due to a blood clot or plaque buildup. Ischemic strokes account for the majority of stroke cases. Incorrect choices: B. Hemorrhagic stroke. This type of stroke occurs when a blood vessel in the brain ruptures, leading to bleeding in the brain. C. Transient ischemic attack, also known as a mini-stroke. It is caused by a temporary blockage of blood flow to the brain, often resolving on its own without permanent damage. D. Embolism. This refers to a condition where a blood clot or other foreign material travels through the bloodstream and blocks a blood vessel in the brain. Question 12. What is the accumulation of fatty deposits along the walls of arteries, leading to reduced blood flow? Atherosclerosis, arteriosclerosis, aneurysm, thrombosis. A. Atherosclerosis, correct answer. Atherosclerosis is the correct answer because it specifically refers to the accumulation of fatty deposits in arteries, causing reduced blood flow. Arteriosclerosis is a general term for thickening and hardening of arteries, not necessarily due to fatty deposits. Aneurysm is a localized, abnormal dilation of a blood vessel, not related to fatty deposits. Thrombosis is the formation of a blood clot within a blood vessel, not the accumulation of fatty deposits. Question 13. Which term refers to high blood pressure, a condition where the force of the blood against the artery walls is too high? Hypertension, hypotension, hyperlipidemia, diabetes. A. Hypertension, correct answer. The correct answer is A. Hypertension. Hypertension refers to high blood pressure, where the force of blood against artery walls is too high. This condition can lead to serious health issues. Hypotension, B, is low blood pressure. Hyperlipidemia, C, is high levels of fat/lipids in the blood. Diabetes, D, is a condition related to blood sugar regulation, not blood pressure. Therefore, A is the correct answer as it specifically relates to the condition described in the question. Question 14. What is a blood clot that forms in a vein, often in the legs, and can cause serious complications if it travels to the lungs? Deep vein thrombosis, DVT. Pulmonary embolism. Varicose veins. Atherosclerosis. A. Deep vein thrombosis, DVT, correct answer. The correct answer is A. Deep vein thrombosis, DVT. DVT is a blood clot that forms in a deep vein, commonly in the legs. It can lead to serious complications if the clot dislodges and travels to the lungs, causing a pulmonary embolism. Varicose veins, C, are enlarged, twisted veins near the surface of the skin, not involving deep veins. Atherosclerosis, D, is the buildup of plaque in arteries, not related to vein clot formation. Pulmonary embolism, B, is a complication of DVT, not the initial clot formation in a vein. Question 15. What is the surgical procedure that restores blood flow to the heart by diverting blood around a blocked artery? Coronary artery bypass graft, CABG. Angioplasty. Stent placement. Valve replacement. A. Coronary artery bypass graft, CABG. Correct answer. The correct answer is A. Coronary artery bypass graft, CABG. This procedure involves diverting blood flow around a blocked artery using a healthy blood vessel from another part of the body. It is the most effective treatment for severe coronary artery disease. Angioplasty, B, involves opening a blocked artery with a balloon. Stent placement, C, involves inserting a mesh tube to keep an artery open, and valve replacement, D, is for replacing damaged heart valves, not restoring blood flow to the heart. Question 16. What is a life-threatening condition where the heart suddenly stops beating? Cardiac arrest. Myocardial infarction. Heart failure. Atrial fibrillation. A. Cardiac arrest. Correct answer. The correct answer is A. Cardiac arrest. Cardiac arrest is a life-threatening emergency where the heart stops beating suddenly. This leads to the cessation of blood flow to vital organs, causing loss of consciousness and death if not treated immediately with CPR and defibrillation. Myocardial infarction, B, is a heart attack where blood flow to the heart muscle is blocked, leading to tissue damage. Heart failure, C, is a chronic condition where the heart is unable to pump blood effectively. Atrial fibrillation, D, is an irregular heartbeat that can increase the risk of stroke but is not the same as cardiac arrest. Question 17. Which condition is characterized by chest pain due to reduced blood flow to the heart muscle? Angina. Myocardial infarction. Pericarditis. Arrhythmia. A. Angina. Correct answer. The correct answer is A. Angina. Angina is characterized by chest pain due to reduced blood flow to the heart muscle, often triggered by physical exertion or stress. It is typically relieved by rest or medication. Myocardial infarction, B, is a heart attack, which results from a complete blockage of blood flow to a part of the heart muscle. Pericarditis, C, is inflammation of the pericardium, the outer lining of the heart, causing sharp chest pain that worsens with breathing. Arrhythmia, D, refers to abnormal heart rhythms and may not necessarily present with chest pain due to reduced blood flow. Question 18. Which term refers to the contraction phase of the heart when blood is ejected from the chambers? Systole. Diastole. Contractility. Afterload. A. Systole. Correct answer. The correct answer is A. Systole. During systole, the heart muscle contracts to pump blood out of the chambers. This phase is essential for delivering oxygenated blood to the body. Diastole, B, is the relaxation phase when the heart fills with blood. Contractility, C, refers to the heart's ability to contract, not a specific phase. Afterload, D, is the pressure the heart must pump against to eject blood, not a phase of the cardiac cycle. Therefore, the term that specifically refers to the contraction phase of the heart is systole. Question 19. Which term describes an abnormal heartbeat that can be either too fast or too slow? Arrhythmia. Bradycardia. Tachycardia. Conductivity. A. Arrhythmia. Correct answer. The correct answer is A. Arrhythmia. An arrhythmia refers to an abnormal heartbeat rhythm, which can be too fast, tachycardia, or too slow, bradycardia. Arrhythmia encompasses both of these irregularities. Choice B, bradycardia, specifically refers to a slow heartbeat, while choice C, tachycardia, specifically refers to a fast heartbeat. Choice D, conductivity, is not directly related to the speed or rhythm of the heartbeat, making it an incorrect choice. Question 20. Which condition refers to the heart being unable to pump sufficient blood to meet the body's needs? Heart failure, myocardial infarction, cardiomyopathy, pericarditis. A. Heart failure, correct answer. The correct answer is A. Heart failure. This condition occurs when the heart is unable to pump enough blood to meet the body's needs. It can result from various factors such as high blood pressure, heart muscle damage, or heart valve disorders. In contrast, B. Myocardial infarction, refers to a heart attack caused by a blockage in the coronary arteries. C. Cardiomyopathy, is a disease of the heart muscle, and D. Pericarditis, is inflammation of the pericardium surrounding the heart. These conditions may affect the heart's function but do not specifically indicate the inability to pump sufficient blood like heart failure does. Question 21. Which term refers to the relaxation phase of the heart, during which the chambers fill with blood? Diastole, systole, refractoriness, automaticity. A. Diastole, correct answer. The correct answer is A. Diastole. Diastole refers to the relaxation phase of the heart, allowing the chambers to fill with blood. During diastole, the ventricles are relaxed, and blood flows into them from the atria. Systole, choice B, is the contraction phase where the heart pumps blood out. Refractoriness, choice C, refers to the period when the heart cannot respond to a new stimulus. Automaticity, choice D, is the ability of the heart to generate its own electrical impulses. So, diastole is the correct term for the relaxation phase of the heart where chambers fill with blood, making it the correct answer. Question 22. What is the amount of blood the heart pumps through the circulatory system in a minute? Cardiac output, stroke volume, end diastolic volume, ejection fraction. A. Cardiac output, correct answer. The correct answer is A. Cardiac output. Cardiac output is the total amount of blood pumped by the heart in a minute. It is calculated by multiplying the heart rate, beats per minute, by the stroke volume, amount of blood pumped per beat. This measurement gives an indication of how effectively the heart is functioning in delivering oxygenated blood to the body. B. Stroke volume is the amount of blood pumped by the heart in each beat, not the total amount in a minute. C. End diastolic volume is the amount of blood in the ventricles before contraction, not the total amount pumped in a minute. D. Ejection fraction is the percentage of blood pumped out of the ventricles with each contraction, not the total amount in a minute. Question 23. Which fibers distribute the electrical impulse to the ventricles, causing them to contract? Purkinje fibers, SA node, AB node, bundle of His. A. Purkinje fibers, correct answer. The correct answer is A. Purkinje fibers. Purkinje fibers are specialized cardiac muscle fibers that distribute the electrical impulse from the AV node to the ventricles, causing them to contract. They are located in the ventricles and ensure synchronized and efficient contraction. The SA node, B, is the pacemaker of the heart, initiating the electrical impulse. The AV node, C, delays the impulse to allow for atrial contraction before ventricular contraction. The bundle of His, D, is a pathway for the electrical impulse from the AV node to the bundle branches, which then lead to the Purkinje fibers for ventricular contraction. Question 24. What structure separates the left and right sides of the heart? Interventricular septum, endocardium, epicardium, pericardium. A. Interventricular septum. Correct answer. The correct answer is A. Interventricular septum. This structure separates the left and right sides of the heart, forming a barrier between the two ventricles. It ensures that oxygenated and deoxygenated blood do not mix within the heart chambers. The endocardium, B, is the inner layer of the heart's chambers, the epicardium, C, is the outer layer of the heart, and the pericardium, D, is the sac surrounding the heart. These structures do not specifically separate the left and right sides of the heart. Question 25. Which valve prevents backflow of blood into the right ventricle from the pulmonary artery? Pulmonary valve, aortic valve, tricuspid valve, mitral valve. A. Pulmonary valve. Correct answer. The correct answer is A. Pulmonary valve. This valve prevents backflow of blood into the right ventricle from the pulmonary artery by closing when the right ventricle relaxes. The pulmonary valve ensures that blood flows in one direction, from the right ventricle to the pulmonary artery. The other choices, B, aortic valve, C, tricuspid valve, and D, mitral valve, are incorrect because they are not located between the right ventricle and the pulmonary artery. The aortic valve is between the left ventricle and the aorta, the tricuspid valve is between the right atrium and ventricle, and the mitral valve is between the left atrium and ventricle.